Hi, I'm Cassidy. I'm a nurse practitioner. Today I'm going to be performing a neurological and musculoskeletal assessment.
Okay.
Any questions or concerns before we get started?
No.
I'll have you start by verifying your name. You can use your initials and your date of birth.
BK 6/24/2000.
Okay, so getting started, I'm going to assess your cranial nerves. The first cranial nerve is the olfactory nerve. So I'm going to have you close your eyes. I'm going to place an object under your nose and tell me what you smell.
Vanilla.
So the olfactory nerve is intact. The patient was able to smell vanilla. Next is the optic nerve. I'm going to stand in front of you. I'm going to have you close one eye at a time and tell me what numbers you see holding up.
1, 2, 5, 1,
And the other eye.
1, 5, 3, 2.
Good. So next I'm going to grab the Snellen chart. Again, I'll have you cover one eye at a time and read line 6 if you're able to.
EDFCZP.
And again.
EDFCZP.
Great. And now with both eyes.
EDFCZP.
Good. So the optic nerve is intact. Next are the 3, 4, and 6 cranial nerves. They're the ocular motor, the trochlear, and the abducens.
Okay.
So I'm going to stand in front of you. I'm going to have you follow the tip of my pen light, and I'm going to be assessing for the 6 cardinal fields of gaze. And as I do this, I'm assessing the patient's eyes. I'm looking for any abnormal eye movements, any shaking of the eyes, nystagmus. So next I'm going to have you follow the tip of the light to your nose. And this checks for accommodation, and that is intact. So now I'm going to have you look straight ahead. I'm going to assess your pupils. And as I do this, I'm looking for pupil constriction, and I'm looking in both eyes. So the pupils are round, they're equal, they're both reactive to light. They're about 3 millimeters, and then in response to light, they go to a 2. So next, cranial nerve 5 is the trigeminal. So I'll have you clench your jaw. I'm going to palpate the masseter and the temporal muscle. And then I'll have you open your jaw against resistance. Good, so that nerve's intact. Next, cranial nerve 7 is the facial nerve. I'm going to have you close your eyes, open them, raise your eyebrows, smile, frown, and puff your cheeks. So next, cranial nerve 8 is the vestibulocochlear nerve. I'm going to have you occlude one ear at a time. I'm going to come whisper a word and tell me what you hear.
Banana.
And occlude the other ear.
Peanut butter.
Good. So I did say the words peanut butter and banana. So next is cranial nerve 9, which is the glossopharyngeal nerve. I'm going to have you open your mouth and say ah. And again. So the uvula is midline, and it does elevate when the patient says ah. The 10th nerve is the vagus nerve, which that's intact. The patient is speaking and swallowing during this assessment. And cranial nerve 11 is the cranial nerve. So I'll have you lift your head up and down to both sides. And then I'm going to have you shrug your shoulders against resistance. Great. And the last nerve is the hypoglossal nerve. I'll have you stick your tongue out, move it side to side. Okay. Great, so all of the nerves appear to be intact. Moving on with the assessment, I'm going to assess your cerebellar function. So I'm going to put my finger up, have you touch your finger to mine, and then towards your nose. Okay, and your other hand. Next, I'm going to have you place your hands like this. Repeat after me. Okay, and your other hand. Great, so that function is intact. Next, I'll have you stand forward. I'm going to have you take a few steps just normally. And as the patient's walking, I'm looking at his gait. I'm assessing his arm movement. Okay, good. So the patient's gait is normal, it's symmetrical, the patient's aligned in midline. Next, I'm going to have you walk heel to toe and do that about 5 times. Again, looking at the arm movement, looking at the gait, arm movement appears normal. The patient is upright, midline, symmetrical. So now I'm going to have you take one foot, place it by your knee, and slide it down towards your opposite foot. And this is assessing for balance. And now I'll have you just stand and close your eyes. This again is assessing for balance. I'm looking at the patient, making sure the patient's standing straight. There's no swaying, no leaning towards one side or the other, which there's not. So you can go ahead and sit back down. Okay. So moving on to the assessment, we have the sensory function. So for this, I'm going to have you close your eyes.
Okay.
I'm going to place an object on you. I want you to tell me what it feels like and where you feel it.
Right arm, it's like a poke. Left arm. Right leg. Left leg.
So his sensory to pain is intact. For the next part, I'm going to have you close your eyes again. I'm going to do the same thing, but this time tell me if you feel 1 or 2 pokes.
Okay. 2. 1. 1. 2.
So now I'm going to come down and I'm going to lift your great toe. I'm either going to put it up or down and tell me what you feel.
Okay. Up. Down. Down. Up.
Okay, and go ahead and stick your hands out. I'm going to do the same to your pointer finger.
Up. Down. Up. Down.
Okay. Now I'll have you flip your hands palms up. I'm going to draw a number in your hand and tell me what you feel.
Okay.
Go ahead and close your eyes.
7.
Good, so that is intact. The patient was able to identify that I drew a 7 in his hand. And next I'm going to have you close your eyes again. I'm going to place an object in your hand and tell me what you feel it is.
Battery.
Okay. So that is correct. I did give the patient a battery, so his sensory function is intact. Next, I'm going to assess your reflexes. I'm going to use a grading scale of 0 to 4, 0 being absent and 4 being hyperactive.
Okay.
So I'm going to have you lay flat. I'm going to assess your abdominal reflex and have you lift your shirt if that's okay. So I'm going to start and go towards each quadrant. And set up. The abdominal reflex appears to be intact. When stimulated, the abdominal muscle is contracted. Now I'm going to assess the bicep. So first I'll have you flex your bicep. Okay, and then relax your arm. And this one. Flex your bicep. Okay, flex. And what I'm looking for is for the bicep to contract. So both biceps contracted equally. They're about a 2. And we have the tricep. So just go ahead and dangle this arm and relax it. So again, that reflex is about a 2. Then we have the brachial radialis. So I will find the styloid and go about 2 to 3 centimeters down. Again, that appears to be a 2 and it was bilateral. Then we have the patellar. I'll have you relax your leg. Again, the reflex was bilateral and equal. I would rate them a 2. Then we have the Achilles. I'm going to flex your foot upward and I'm going to feel for any downward. So that reflex is also a 2. Now we have the plantar. So I'll have you lift your foot forward. Okay. All right. Again, that appears to be a 2 and all the reflexes are intact. And now I'm just going to check for clonus. So I'm going to grab your foot and go ahead, just relax your foot down. I'm going to pull up and let your foot drop. So there's no clonus noted. The last part of the assessment is a musculoskeletal system assessment. So just starting off by inspecting, I'm looking at the skin, I'm looking at the patient's position. The patient appears midline and symmetrical. There's no deformities noted. So next I'm going to palpate the skin around the joints. I'm looking for any nodules. I'm feeling for any warmth, seeing if it's tender to the patient, any nodules, edema, and none of those are noted. The skin is warm, it's appropriate. So next I'm going to palpate the muscles. I'm looking for the alignment, the contour of the muscles, looking for symmetry. And the muscles are contoured and they're symmetrical. Okay. So now I'm going to palpate the joints. And then as I palpate the joints, I'm going to do passive range of motion. Again, let me know any pain or tenderness during this. And the elbow. Leave the wrist and the fingers. Okay. And we'll go on this side. And I'm feeling for any crepitus, and so far none is noted. Down to the wrist again. Move your fingers. Okay. You have the knees. The ankles. The toes. So next I'm going to assess for active range of motion. I'll have you lift your head up and down to both sides, lean towards both ears, and all the way around. So next part, I'll have you stand up to assess your shoulders. I'll have you lift your hands all the way up and then flex them behind. Okay, and then if you go all the way up this way, and then back, and all the way back. So while the patient's standing, I'm looking at his spine. There's natural curvature of the back. The patient is standing upright. There's no deformities noted. And then go ahead and just go in a big circle. Okay. So go ahead, you can sit back down. You can hyperextend and flex your arms. Roll your wrist, your fingers, if you can flex and extend them. I have and adduct them. Okay, and your knees. If you roll your ankles and your toes, and you point your foot, point it and flex it up. Okay, and the same on the other leg. Roll your ankle, spread your toes, curl your toes, and point up and down. Good. So the patient appears to have good active and passive range of motion. Next, I'm going to assess the strength of each. So we have the hands and wrists. So I'm going to have you squeeze my hands, okay? And then I'm going to assess the strength of your fingers. So go ahead and pull up. Good. And pull up again. And then the wrist. Go ahead. I'm going to have you put them this way. Try to push up, push down, and go like this. And try to pull. Okay. So for the shoulders, and have you go out and try to push down. Good. So the shoulders, go ahead and shrug against resistance. And then for the cervical spine, I'm going to place my hand, push down, and then you go ahead and try to push up. And go ahead and try to lean forward. So to check for the spine, and the thoracic and lumbar spine, I'm going to place one hand in front, one behind. Go ahead and try to twist the opposite direction. And again. So now I'll test the temporal mandibular joint. Go ahead and try to open against resistance. And again. And there's no crepitus noted. So again, we'll have the legs. Try to push forward. And now try to pull back. And then with the feet, lift up. And then push down like a pedal. Okay, good. So now I'm going to have you lay back. I'm going to check your hips. I'm going to bend your leg for you under 90 degrees. And then go ahead and try to push back. And we'll do the same to this leg. Try to push back. So now I'm looking at the patient's feet where there's non-weight bearing. I'm looking at the alignment, the contour of the feet. There's 5 toes on each, 10 total. The alignment is midline. Okay, so go ahead and stand up. Now I'm doing the same with the patient being awake and looking at the contour, alignment of the feet are aligned, they're symmetrical, and again, there's 10 toes total. So you go ahead and sit back down. That concludes our assessment for today. Do you have any questions?
No.
Okay, thank you for your time.
Thank you.